But so we practice, last time I counted, we practiced about 20 modalities of biblically sound, evidence-based Christian clinical interventions. Hope focus, Gestalt. I want to talk about two or three probably of the most used ones, I would say. Dialectical behavioral therapy, cognitive behavioral therapy, and of course I think one we use more than any is probably acceptance, therapy. But could you sort of, let's talk about those. Let's talk about cognitive behavioral therapy. What are we doing with cognitive behavioral therapy?
As a man thinketh, so is he. The more we think something, we just don't know how to change it, move it to make sense. The triangle of what we think to what we feel to what we do. And often we get stuck in the thoughts. So it's revising the thoughts, asking it to move, asking it to be different, and then adding the spiritual, what does God say about this? And I know the triangle is this way, which is fine, but the spiritual approach to that too, it just lets real transformation happen in the mind. There are many people who come who are very left-brained people, and CBT often works really well for them.
When you say left brain, are you talking about cognitive or explain?
We're talking about people who are very analytical.
Okay, that's
people
that's
who
the left brain.
stay
Okay.
here, and that's their focus. So well developed, and then you ask them about relationships. Oh my gosh, what's that?
Yeah.
What's that? But CBT is taught in groups, and so it's practiced in groups too, and then done in therapy, of course. But teaching it, oh goodness, and that's what certain therapists do, and they teach that: sheets, exercise, practice, rehearsal. And that's how we do it. Otherwise, we won't know what to do, and we'll get stuck in the thinking, feeling, and forget about the action. And CBT does require action.
So it's like if I was in a gym and I could look at all this equipment and know this one's going to build my biceps, this one's going to build my abs, this one's going to build my shoulders. But if I just sit there and look at it and acknowledge that that's what it's going to do without sitting on that equipment and using it, my muscles are going to stay where they are today.